Hello, my name is Vanessa Adams. I'd like to talk to you about how we can reduce medicine's impacts on climate change, loss of biodiversity, and pollution. It's hard to think that a packet of small tablets can have much of an impact on climate change, yet pharmaceuticals are estimated to be the largest contributor to NHS Wales's carbon footprint. This is not only in hospitals but across primary care too, where pharmaceuticals and metered-dose inhalers make up more than 60% of the impact on the environment. The impact is increasing year on year with increasing population, increasing chronic diseases, and increase in medicines used both to treat diseases and in prevention. So how does a tiny tablet or two have such a huge impact? This diagram represents the life cycle of medicines. Discovering a potential new medicine often involves screening thousands and thousands of compounds. Potential compounds are then formulated and entered into a number of clinical trial phases. These become increasingly multi-centered across the world with both the tablets and researchers moving around the world to collaborate. These stages are also very data intensive. Having made it through clinical trials and licensing, there's marketing and manufacturing. So if we pause for a moment and think about what goes into making a medicine, one of the largest suppliers of the ingredients to make up the active pharmaceutical components is China. One of the most common places for these ingredients to be formed into active pharmaceutical compounds is India. Many of the excipients which are important to ensure the medicine is delivered to the right area within the body come from South America. Similarly, tabulating and formulating happen across the world. These are not the only places. Ingredients and excipients can come from Africa, Eastern Europe, and other Asian countries. It's only some of the more specialized medicines which are manufactured in Europe. This is not unique to medicines. It represents many of the goods in our shops. Going back to the medicine's life cycle, to reach the shelves in pharmacies or supermarkets, medicines have already been back and forth across the world. When a medicine is taken, between 30 to 90% is excreted, either in its active form or as an active pharmaceutical metabolite. Anyone who's visited patients in their own home would be aware that a number have cupboards full of medicines, which they're unlikely to take. Research has confirmed that many end up being flushed down the sink or toilet or popped into the bin, ending up in our waterways and groundwater. And then there's the issue of packaging. So looking at detail at excretion, approximately 20% of APIs are not captured by sewage treatment. This adds to the complexity of the process, as more than 600 pharmaceuticals have been detected in sewage effluent, ground and surface water. As mentioned, many processes occur in countries who have less sophisticated treatment plants and less stringent environmental laws. A worldwide study found the river with the largest pharmaceutical contamination was in Bolivia. Incorrect disposal and difficulty in removing pharmaceutical waste from water leads to accumulation of pharmaceutical ingredients in the environment, exacerbating the second environmental crisis, loss of biodiversity. Medicines are designed to interact with living systems and not to be biodegradable in the environment. And here plastic pollution adds to the issue, as medicines like fats absorb to plastics, further increasing their persistence in the environment. A worldwide study sampling rivers found active pharmaceutical ingredients, APIs, in every continent. With the exclusion of 2 rivers, all rivers sampled, including the River Dee in Wales and a river in the Antarctic, had measurable levels of one or more of the 61 APIs tested for. More than a quarter had high levels of APIs than classed as safe for aquatic life, and high levels of antibiotics were found in a significant number of rivers. This is thought to be exacerbating the issue of antimicrobial resistance across the world. What we know less about is the effect of APIs in our environment have on plants and animals, but limited studies have shown both acute and chronic toxic effects, from the molecular level to behavioural changes to reduce fertility. Although the quantity is not normally toxic to humans, active pharmaceuticals have been shown to have an effect on a number of animals and plants, and this accumulates through food chains. Like the human body, our world is finely balanced and interconnected. A small disruption can have many consequences. For example, we know that plankton are decreasing at an alarming rate, which is potentially linked to pollution or the effect of climate change heating and acidifying the ocean. We also know plankton produce 70% of the world's oxygen and absorb more than 50% of the Earth's carbon dioxide. So decreasing plankton numbers is also accelerating climate change. These tiny creatures are at the bottom of the food chain. As small amounts of pollution they ingest magnifies across the food chain. There's an infamous case where the population of vultures in Pakistan was decimated. They fed on cattle treated with diclofenac. And there's growing concern regarding the number of endocrine disruptors in the environment and the potential effect on human health, including cancers and loss of fertility. Most medicines come in plastic and foil blister packs. Most of us will have looked at the packaging and pondered which bin to pop it in. Plastic has a significant impact on the environment. Produced from oil whose extraction and transport causes deforestation, environmental damage, and increases greenhouse emissions. It cannot be biodegraded. It remains in the environment forever, simply breaking down into nanoplastic. You might argue we're all in healthcare and already working extremely hard to help people. We don't have the capacity to tackle these large issues, which are mainly affecting other countries. However, we know climate change, loss of biodiversity, and pollution are increasing health problems in the UK, now and for future generations. Looking at air pollution, not only is this now globally the second biggest risk factor for death in the under fives, and linked to 1,000 newborn deaths every day across the world, was linked to 30,000 deaths in the UK last year. We also know that we're all inhaling a credit card size of microplastics each week. The effect of this is unknown, but increasingly nanoplastics are linked to the increase in chronic diseases, and we do know that nanoplastics are found in every organ of the human body. And air pollution is not just linked to COPD, asthma and lung cancer. Studies in Europe have linked air pollution to increased strokes, cardiovascular mortality, and analysis of UK biobank data found a 31% increase in heart failure with long-term exposure to air pollutants. Air pollutants have also been shown to increase the risk of hypertension, atrial fibrillation, and even diabetes. Diabetes is also exacerbated by increased temperatures. Temperature increase has been shown to increase mortality. There were 70,000 additional deaths in the 2003 heatwave in Europe, and 3,000 additional deaths in May and June this year in the UK. Sometimes it's hard to know where to start and easier to avoid the issues, but there are numerous things we can all do. In Wales, we're fortunate to have clear legislation, the NHS Wales Decarbonisation Strategic Delivery Plan, which aims to integrate environmental sustainability into all clinical guidelines. The Lancet have launched a dynamic database that details carbon data for pharmaceuticals, medical and surgical devices, and diagnostic services. This data can be used to compare, for example, medicines from the same class, or the carbon footprint following changes in a care pathway. The Sustainable Healthcare Coalition has a care pathways carbon calculator, which organises components from a pathway into blocks to help facilitate calculating the whole carbon footprint of a clinical pathway. As health professionals, we're in a very privileged position. We're amongst the top most trusted professionals, and we speak to a wide range of people. We know whatever area of medicine you work in, this is the biggest health challenge. It's important we use our voices to help patients understand the link between climate change, pollution, and loss of biodiversity, and their health to empower them to make informed choices. There are a number of speciality-specific sustainability or green groups, which help provide a good place to understand how you can have an impact in your area of medicine, to share ideas and good practice. Thinking of medicines focused actions, ensuring patients think before they order their medicines to ensure they only order what they need, and are aware of how to dispose of medicines correctly is an important part of prescribing and dispensing. Numerous studies have shown that people do not take medicines as we intend. Patient education and understanding the patient's perspective, discussing the benefits and risks both on an individual and planetary health level, enables joint decision-making, increasing concordance. Within this, the principles of sustainability align closely with value-based healthcare, prudent healthcare, preventative healthcare in the wider sense. Creating an environment where patients feel they're able to admit to not taking their medicines as instructed is important both in their treatment and for planetary health. Regular reviews facilitate deep prescribing, which prevents medicine's accumulation. How we phrase things is also important. When starting a medicine, referring to a defined length of use to check if it's of benefit is important. For example, I'm going to trial this medicine for your hypertension whilst you make lifestyle changes, as discussed. Or a short course of painkiller while your leg is healing. Ensure following the principles of the Needless Needles campaign. Ensure we're only doing tests whose results might give valuable clinical information or help decision making or guide clinical plans. Specialists have a valuable role here, advising on how frequently to monitor, for example, kidney function, and prescribers in interpreting this in the context of individual patients. Ensuring environmental impact is considered in all clinical pathways, including the role of green or social prescribing and treatment options. Putting guidance in the Gloves Off campaign to minimise unnecessary waste and advice on moving away from single-use surgical instruments. I'm sure there are lots more ways that you can think it too. Another good way is simply by leading by example, both professionally and in our personal lives. Sometimes discussing the benefits in terms of planetary health is unlikely to resonate. Highlighting other benefits, reduced risks, cost benefits of changes can enable changes which will also secondarily benefit planetary health. Most sustainable initiatives save money in the short term as well as the long term preventative costs. As a final reflection, I'd like you to draw your attention to the words of U Thant from a speech made 55 years ago. We may ask ourselves seriously whether we really wish some future universal historian in another planet to say about us. With all their genius, with all their skill, they ran out foresight and air and food and water and ideas. Or they went on playing politics until their worlds collapsed around them. If we work together, we can turn around this crisis. But time is running out and there needs to be urgency in what we do. Here are some good starting points. Thank you for your time. Please do contact me if you'd like to connect or have any ideas on how we can work together or any comments. Thank you.